Hello, everyone, and welcome to the show. This is Franz Sidney. Welcome to Create with Franz. This is a program that is designed to improve your life step by step. And a lot of it is based on neuroscience and on mindset. But what happens when neuroscience and mindset are not enough? And that's why we have something called psychedelics. That could be an answer. Magic mushroom. Are you shocked already? And that is exactly what we're going to talk about today. And we're going to do that because there is a mental health crisis where people simply cannot access mental health resources. They don't have the funds, or they have to wait months and months, or there is so much mental stigma and social stigma about it. So people end up having a condition that might last for many, many years. And society will set these people apart. Maybe they're veterans, maybe they're alcoholic, maybe they're people who've been through PTSD. So let's talk about it with somebody who's been really in the trenches for many years. And this is Kathryn A. Walker. So thank you for coming to the show and welcome.
Thank you, Franz.
Kathryn has been working for many years as a nurse at a trauma center in Tennessee. And then she started to really notice things that were going on that made her understand the connection between physical health, emotional health, mental disease. And also, she trained in several different areas until she became a psychiatric nurse. And if I remember well from my notes, you are now training, and I think you're doing an advanced degree in psychiatric nursing. These are all difficult words for me to conjure with my Italian jaw. But basically, the belief that Kathryn wants to put across her mission is that if we treat every individual as a whole, and if we recognize that the mental health and physical health are connected, so if we start using therapies that address the whole thing, we're going to get better. But also, she saw how things become chronic. And she's very, very keen. That's why she put together something called a Revitalist lifestyle and wellness clinics, which are sadly only in Florida and Tennessee. They're not worldwide. But, maybe people will be inspired to do more research in with psychedelics and ketamines and all sorts. They have been mentioned very much in Huberman Labs, so people will be familiar with that. But I really want to know, how did we get to this mental health crisis?
Franz, it's a really good point with the mental health crisis. And I've been a nurse for about 20 years. I have 3 degrees. So I've been a nurse for about 20 years. And then I practiced anesthesia in the hospital for about 10. And then I've had my psychiatric degree now for a few years. So, kind of seeing the deficits. So one neat thing about anesthesia and nursing and anesthesia, right, is we're kind of a core concept. So nurses usually have to understand all the systems in the body. Anesthesia has to understand that plus some, like on steroids, right? So, when I was trained for anesthesia, I have participated, with pediatrics needing brain surgery or open heart surgery, or, your child needing orthopedic surgery, or your parent needing heart surgery. And as an anesthesia provider, that's our specialty, is putting everyone to sleep across the entire lifespan, across every organ system. So we have to be experts in working with every specialist there is. And also having communication skills to talk to you about your health, your child's health, your parents' health. There's been several times when I worked in the ICU to where we would actually take people off of the ventilators, right? So we also had end of life care, because in the hospital setting, there are no therapists. I think people forget that. There are no therapists in the hospitals. The only therapists that exist in the hospitals are nurses and chaplains, and that's it, right? So, nurses, we've learned a lot of things along the way. So when I got out, I did used to do, a lot of neuroanesthesia. I did obstetrics. I used to do epidurals and spinals and all those different things in the hospital. But when I got out of the hospital and I opened the clinic in 2018, I really started seeing, wow, there's a big issue here. And that big issue, Franz, is when you're in the hospital as a nurse, that's my base degree, we are trained to advocate for you. I am now your protector. Should you come into the hospital, should you be the person that's on my list for that day as an anesthesia provider or as a nurse, like I've got your back. It's my ethical responsibility to have your back. We lose that in the outpatient sector. Who becomes your advocate? You do. You become your advocate, and that's it. And what do we do from the medical standpoint? And this is one thing, like I've worked with every specialist there is out there. I understand the specialist communication styles. I understand their different personalities. I understand all those things. We make you feel guilty for advocating for yourself. So when you come to me as a provider per se and say, you're telling me your symptoms, the way you feel. I'm like, yeah, I think you probably have this. Let's do these lab draws. Let's do these diagnostic imaging. Let's do all this. And then you're like, okay, I was looking at this article and I really feel connected to this article. What do providers tell you oftentimes? Oh, I'll look at it later. Or, oh, did you go to medical school, Franz? Do you have a medical background? So
I know. They will tell you, stop Googling.
yeah. Oh, they do.
They tell
Yeah.
stop
Stop
Googling.
Googling. Google
And
is not a doctor, right? You don't know what you're looking at, and,
yeah,
and that's to a point that's true. But
yeah.
in the medical world, in the behavioral health world, in any type of medical specialties, we've never looked at when I say that to someone, how is that coming off? Am I kind of abusing that person? Yeah, we kind of are. As a provider, we're making them feel like they're not being heard. We're invalidating them, and we're not taught how to collaborate with the person and how to respect that person. So when in 2018, yes, I opened the clinic to help people. But really now it's changing the narrative on instead of me saying, oh, yeah, I went to school for 12 years. I'm pretty good at what I do. Let me help you, Franz. And this is the way my company's set up, and this is the way all my partners are. Franz, what do you want? What are you looking for? What do you align with as a person? And how can I help you? Not you're going to listen to me because I'm the expert. How can I best support you, Franz, on your journey in life? And this is where, psychedelics can kind of come into play too, because some people may not want to go to therapy. They may not want to do massage or acupuncture or diet changes or antidepressants. And that's okay. That's okay. What do they want, and how can we best help support them with the skill sets that we have? And that's one thing that I'm really working on. And yes, I'm a subject matter expert with ketamine, but I understand psychedelics pretty well. Anesthesia providers, I joke, but it's true. We're professional drug dealers, right? Nobody understands drugs on giving them to people better than an anesthesia provider. We are the ultimate drug dealer, to people. It's a really good thing to have, to a point, because when we're seeing psychedelics and we're seeing these changes in real time that are happening to people, there's not a lot of specialties that actually have that training. So we're seeing the changes. So now we've got to figure out, how do we put that language? Like, where's the terminology? Where's the dictionary? And that's one thing, Franz, is there's so many communication barriers in medicine and in behavioral health. So many. There's probably thousands of communication barriers. So when people say, oh, I'm seeing a healthcare provider, well, we're like, oh yeah, healthcare it's like one, right? It's healthcare. Underneath that healthcare umbrella, your heart surgeon may not be able to communicate with your pediatrician, who may not be able to communicate with your therapist, because they're all trained very differently. So we've got to figure out, how do we synergize this space? How do we tell people the brain actually does have direct correlations with the heart? which has direct correlations with the blood, which actually influences your thinking patterns. Like, how do we break all of that down? And the way that we do it is we start defining it, but we've got to do it from the ground up. So so when I'll sit there, if I'm sitting there and I'm on the phone with a neurosurgeon and a therapist and a researcher, all three of them are very different. But my nursing background, where I've worked with these people individually, is I can pick out the commonalities in language and try to get these three very unique specialties to work together in order to advocate for the person. So it's Franz, this is a brand new rodeo that the world's seeing right now. And we've got to figure out, it's gonna be beautiful. It is, but we can't be siloed anymore in medicine and behavioral health. They all exist. The only silo we need to see is like the body, right? It's like the body, the heart, the mind, the soul, all the things that exist. That's the one thing
It's
that we
holistic.
need to be focused on.
Yeah. So it is, such a good point that we are not separate systems. We are maybe separate systems, but we are so connected together.
Yeah.
And I think that's why holistic medicine, herbalists like me, nutritionists, they help so much because sometimes you see a person that comes to school and they're not listening, they're fidgeting. Oh, they must have hyperactivity disorder. Well, have you looked at what they're doing? Are they going to bed at the proper time? Are they eating nutritious foods? Are they high on sugar? Do they have a parents on the brink of divorce that are shouting the whole time? Does the child feel neglected at home? Is he eating something that makes he have sugar craving and crashes all the time? Is he hyperactive or is he bored because the teachers are boring to death? Is he bullied? Nobody's looking at that. They just go to the doctor, give me a fix. The doctor give him a pill, and then they say, oh, it's not better yet. More pills. And that's why we think, why don't we look at the whole situation? Because many times people are ignoring the obvious. There is something called the environment that will affect everything. For example, women are very happy to have a baby. How many do they have postnatal depression? They don't need antidepressants. They need to get the hormones checked. They need their diet there, and they need somebody to help them because guess what? These people have not slept for months. They are tired and they have to do all their work in the house and look after the baby while not sleeping at night. They don't need antidepressants. So, looking at the whole picture for me has always been a very important thing. But here we go. We go here and we go to the doctor, and he's got this protocol. And he thinks that one size fits all. And that doesn't work, does it?
Well, you have to understand the system, right? And the system, it's not right and it's not wrong. It's evolving, right? I guess as people, right, we're always evolving one stage or another. But you have to look at the current system as to how practitioners are taught. Like, we want to help people. That's why we go into medicine and nursing and all this stuff. Like, we are servants of people. We're being taught by those who have the most money, right? Because the schools have to be open. They have to, function. So when you go and you look at like who sponsors the texts that we're learning off of, and usually it's pharmaceutical companies that are sponsoring the text that we're learning from, right? So physicians are taught Western medicine through pharmaceutical companies, and they're not taught they're not necessarily taught critical thinking skills from beginning to end. Their physicians are interventionalists. They know how to come in. They know when to tell you what to do, Franz, but they may not know the entire system, right? And we're not taught that. We're taught to think critically, but we're not taught to think from beginning and end. And that's what psychedelics are allowing us to do, is kind of see the alpha and the omega, with all of these pieces. And what I love about psychedelics, Franz, is, well, one, like this is how crazy it is. Like, I lost my job over opening the clinic because I got asked by the hospital, do you want to do real medicine or voodoo? And I knew the voodoo that I was choosing actually had more unbiased data behind it than anything that we do in the hospital system. So I chose voodoo. But the thing about all of this is like psychedelics are going to change the world, but we have got to stop trying to box everything so it only fulfills our egos. And that's going to be a really hard thing for everyone to do because, egos, we all have egos, right? They're protective to a point, but we've got to start realizing when are we feeding our ego versus when are we going to be humble enough to actually help those around us. So with psychedelics specifically, it's changing the way that our brain functions, right? And a lot of people are like, oh, it's natural, it's safe. Not everything that's natural is safe. Natural and safety do not equal the same thing. And unfortunately, the psychedelic community believes that for the most part right now. Just like psychedelics help to reset a lot of things in our brains. And we were talking about that like females, when we have postpartum depression and things like that, one thing I've noticed is that a lot of times when we struggle with mental health, it's because we're shifting in our identities. So it could be when we change jobs, when we get divorced, when we have a child, when we lose a dog. It's something that changes our day-to-day pattern. It's gone, right? And we have to rediscover who we are. That's when psychedelics really come into a beautiful play because we're able to kind of rediscover that. We feel more aligned with what our purpose is at that given time. And that really helps to reset. But also what that does, Franz, is it with mental, like in the mental health world right now, in the medical world, what you just said earlier, take a pill and you'll feel better. There's some people that are doing that with psychedelics right now. They're taking psychedelics to feel better. Psychedelics they're not made for you to take to feel better. They are to do an intervention to where you can reset and then you can be your own internal healer. And I know people may think that sounds like voodoo, but here's the medical aspects. The brain reciprocates what it knows. It's just like muscle memory, right? It's like cancer. So if there's a cancerous cell, the brain's going to duplicate that cancer until we stop it. With psychedelics, it's going to reset and it's going to allow everything to reset, giving us the opportunity to heal. So our brain and our body will either give us the opportunity to heal or it will give us the opportunity to be sick. And the whole take this pill and you'll feel better is not psychedelics at all.
No.
And we can't put it in that category either. And I know a lot of people are like, oh yeah, this is a new way of thinking. Like I take ketamine every day. No, it's not the way it's intended. You take it, you feel that present moment of feeling disconnected from all the heavy things in life. And then you figure out like, what's your next step? What are my intentions now? What are my goals now? What are things that are actually achievable that are within my control? That's the way you use psychedelics. And that's why I'm trying to be out there as much as I possibly can, because we don't need to take a new drug and put it into the old system. They're both new. We've got to recreate it for the future. And I'm very, very pro psychedelics. I think that they're going to change all kinds of stuff, pain, mental health, neurodegenerative conditions. It's going to do all of these different pieces, but it's going to take all of us to step back and reframe the way we look at things.
Can I ask a question then? So, does it mean that these ketamines and magic mushrooms and all these unreadable, unpronounceable, for Italians, substances and chemicals, are they good for every single mental condition in the world, like bipolar, schizophrenia, whatever? Or they're just for certain things? Because in your website, you do mention PTSD, veterans, and treatment resistant depression. So, what What kind of mental health are we talking about here?
Oh, right now. So again, it's going to be all evolutionary. Now, me personally, do I think yes, that people can do them on several different levels with several different conditions? Yes.
Hmm.
But you have to understand anything that we do in life is either all or none, or more is better, right? So that's one thing we have to be very, very careful about. And you have to be with a very good specialist, for to make sure those high acuity cases that you do have the proper care and support and all those things. So yeah, depression is the most common, but it's also the biggest blanket diagnosis. Anxiety is very good with psychedelics, PTSD, OCD is starting to be one. OCD is a hard condition. ADD, ADHD. Us personally with Revitalist, we do treat bipolar. We have had people that have had schizoaffective disorders, but you
Hmm.
have to be very, very well aware. There's a very thin red line that you cannot cross. So, I wrote a book, Franz, and I talk about like kind of the universal laws of physics and kind of that the polarities and different things. But to me, the brain's always seeking balance, and that balance isn't always good, right? So if we're overdoing it this way, we're going to fall harder, kind of thing. So that balance is always there, but the spectrum of balance is different. So treatment resistance, which is an interesting statement because everybody likes to say treatment resistant. Treatment resistant, there's actually not an accepted definition for what treatment resistant is.
Right.
So Medicare's most accepted, but it's not officially accepted definition is you've tried at least two treatments, two therapies. Now, insurance
Hmm.
companies, they usually make you try all these medications. And honestly, Franz, it'll be interesting to see if actually the statistics on medications when they're in an unbiased world, because the statistics for these medications are not good. Like their placebos sometimes better than some of these other statistics. But some insurance companies will say treatment resistant is that you have to fail 4 medications or you have to fail 5 medications, and they need documentation of it. And my personal opinion is if a medication's only working 20 to 30% of the time, why even start? Right. But there is some data,
Hmm.
if you want to really get down some rabbit holes, is there's a study called the STAR-D trial. And that's actually where a lot of people will actually refer to the STAR-D trial. And actually, there's data now coming out saying why the STAR-D trial should not be considered at all. Because that their data was skewed and the statistics were actually way worse than what they are. So treatment resistant at Revitalist, treatment resistant is I don't want you to come do ketamine when you're like, I've had a bad day today. No. Treatment resistant, I mean, like to me, that's like, have you tried anything? Have you tried a diet change? Have you tried therapy? Have you tried massage? Have you tried yoga? Have you tried like something? Right? Because really, it needs to be that we've tried things that help to improve our emotional intelligence before jumping to ketamine or jumping to psychedelics. Like it's good to try some type of insight. But no, Franz, I'll tell you, the
Hmm.
insurance companies, they usually don't count therapy as a tried and failed intervention.
Not surprised.
Yep.
I'm not surprised. I thought it's a
It's medications, 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 medications,
there's
pills,
so
pills, pills.
much profit driven interest here. So I don't want to, I
It's
mean, I'm
ignorance.
here.
Well, in
So,
medicine, we don't even look at therapy like it's real. I mean, I guess there's probably starting to change now, but there's actually neuroscience changes with therapy, with coaching, with having
yes.
insight, with learning how to be calm. And I ask people that when I go to conferences, who taught you to be peaceful and calm? And nobody teaches us that. We just expect it comes naturally. It is a learned skill.
It's a learned skill, yeah.
And we really, I mean, I was telling somebody the other day, I think we'll go in time saying that our generation right now with what we're living in may have been one of the most abusive of generations in all the world, right? Because we're not teaching people what they need to live. We're teaching them what they need to not be sick. And it's really disheartening.
Yeah. It is true, and I have always noticed there was is it Spiegel, one of the most famous hypnotherapists in the world, and he was there in Huberman Lab, and they talked about loads of stuff. And one of the things that there was like a couple of years ago, he did say that a lot of the stuff that we think we have to medicate is a lack of a skill, and that skill, positive thinking, is a skill that has to be learned. So if you think about it, we're here the whole day with a diet of social media and doom and gloom on everything, uh, trolling, people that get abused all the time, on video, in porn websites, on movies. You go on a forum, put your opinion, and people jump on you. So people have to learn this new skill of kind of pushing away these unwanted thoughts and bringing in something different. And I remember there was Anne Marie, what's her name? Anyway, she's a meditation teacher from Corsica, France, and she came to my program maybe 6 months ago. You would love her interventions because she learned through a sad episode. There was a suicide in a school in her town, and they learned all to get together and to talk about what does it mean to have good mental health. And one thing was she learned if you go to a school and to families and teach the family how to be calm, how to be peaceful, how to meditate, mental health problems were just kind of going away because people had time to be present and to really connect, and all of these things that for centuries they've been taught from religions and philosophy, from Buddhism to yoga to Christian philosophy. Was like, pray. What are you doing when you're praying? You're present, you're thinking about something big that can help you, you have faith, you have positive thinking. When you're desperate, you hold on to that, you hope that your own God or your own energy will help you. So you have this positive thing, and you're predisposing your whole system to go somewhere good. But in the modern society, oh no, I don't have time for this. I'm gonna have a coffee, I'm gonna have a drink, I'm gonna have food. I always say the answer is not in the fridge, but people are medicating with food, with drugs, which is why ketamine and ecstasy, they are so famous, because people understand these drugs do something and they're feeling not very well. And so they think, oh, I have this uncomfortable feeling and I'll be better if I have a drug. Which leads me to my last question, because I see that we're running out of time. What is the profile of the risk of taking these drugs once, go to the doctor, have a supervised medical intervention with this ketamine, say, for example, feeling amazing, change your life, and then after a few months, what is the risk of falling back to the thinking, oh yeah, so now every time I feel down, I have to go back and have more, and if a doctor will not give me a boost, shall I go to an ecstasy dealer? How risky is this? Because we are talking to a public here, millions of people are in the internet. They might find this video and say, I can now go to the discotheque and get ecstasy. I'm like, no.
Mhm. Yeah.
So 2 minutes.
So with ketamine specifically, like it's not addicting like opioids are, all right? So when we take opioids, our brain actually needs more. That is not ketamine. What ketamine does though, what psychedelics do, they help you to sit with yourself in the present. And when you sit with yourself in the present, you are not connected to depression, anxiety, nothing, right? It's a learned skill to sit with yourself. What we have to see is every time we're struggling with anxiety, depression, trauma symptoms, there's something going on and there's this coping skill that we don't have yet. And we've got to build that coping skill. So do people need to come back and get boosters? Absolutely. Is it the drug that's actually helping them? No. It's resetting you, and it's you that has to learn those next best steps. And that's, Franz, we're going to have to reset that. Like that, the whole medical field does not understand that. Our brain is so amazing. It regenerates. It's like our liver. Our heart regenerates. After we have a heart attack, our heart will actually regenerate. Like most of the things in our body will regenerate. And psychedelics are allowing us that reset button to regenerate. It's you that are healing. It's not the drug. So people who want to come back, like safety profile wise, psychedelics, like ketamine's on the World Health Organization's national list of essential medications, right? It's great. It does a great job. Ibogaine, everybody loves it, but it has some cardiotoxicity that they're trying to work on. So we should always walk in and say they all have risks. But are the benefits better than the risks, or are the risks higher? One or the other, right? But we should always measure that when we walk into any type of medication. So yes, safety profile across the board. I love ketamine for adolescents too. I wouldn't say for psychedelics. There's just not enough data there. But yeah, anybody 18 years old and older that are looking into psychedelics, look into it. Sure, absolutely. But realize like there are benefits or risk, and you want to weigh both sides.
Yes, that makes sense. Yeah, you don't want to promote illegal drugs. We're trying to understand this is a medical supervised action done with a very specific aim, with a target, and then you have to do the work. So it is
That's right.
important. So I'm glad to see that not for everything, but for many types of disease where you are encountering all sorts of problems, it is worth talking to a specialist, not just to a GP in the UK or to a dottore di famiglia in Italy, but maybe to a specialist who works with psychedelics and has some data. And it will be possibly advisable to have more studies. So more data, more meta studies eventually, so we can see exactly what can be done, because literally there are people who are homeless on the road, etc., with this continuous mental illness. And I always wonder why we cannot save these people. There must be something to help these brains. And I don't have a training for that. And you guys are studying this and you see it all the time. So, as we have very little time left, let's say that I am a person and I come to you and I say, okay, no, I haven't come to you yet, right? So I have this problem and I've been to every single possible therapist in the world, but I still have this very strong anxiety or trauma flashes. So whatever, I've done somatic therapies, I've done psychiatry treatment, nothing works. Antidepressant don't work, anxiety make me have all sorts of gut issue. And where do they go for information, just to know? Because on the websites, you might find a lot.
Yeah. Well, I mean, one thing that I like to tell people is like we have providers, that actually do a virtual session, kind of like we're doing right now, and it's
Hmm.
60 minutes long. And my team's all been trained to talk about your past medical history, like the pathophysiology, the pharmacology, like and to lay it all out there, right? Like our duty is to help bring you information to where you make the best decision for yourself.
Hmm.
So, we offer, I mean, literally, we charge people $49 for a 60-minute consult. And the only reason we charge people anything now is because we used to do them for free, but people wouldn't show up. So if there's $49, like it's literally a $500 appointment that we're giving to people for $49, to where they can get so much education, in a 60-minute period about this. So that's what I would say. It's like, and I don't care who they are. I don't care if you're like, I'm not sleeping. Like, it's like if it's sleep, if you feel sad, if it's whatever, even if you've never done any type of medication, you've never done therapy, there's always an option to talk to someone within my company, to where they can give you a lot of the information that you may be seeking, that may be life changing. Who
Yeah.
knows, right?
Yeah.
But I think that's the barrier, right? That a lot of people feel is like, where do I go? It's like, just call Revitalist, and I'm happy. I don't care if you're in Italy, or if you're in Canada, or you're in Australia. Just call, and we'll have somebody meet with you, and you can learn, like what's the next step in life.
Yeah, education is always power. If you don't know what it is, you don't know what it is. And sometimes it's really desperation. You're desperate for something, but you don't want to end up in the drug dealer's hands, and you go to a maybe ex-anesthetician, or you're still doing that. And then and really help. What happens in your body when this, I've never been for like chemical solution to anything, but hey, there are supplements that help. You can get calcium, magnesium. Maybe there is something that the brain needs to do, and it's this reset. Otherwise, we're always in this cycle of thinking, always in the same way. We can't get out of it, and sometimes a little push, boom, And then we can start really working with a clear slate. It's like an amnesia almost of a past or something.
So Franz, what if it's not chemicals that cause our mental health issues? What if it's our issues that cause our chemical changes,
But that's obvious
right?
because,
So
yeah,
so if we can change our environment, then we can re-regulate the chemicals that help to support us. So
yes,
unfortunately, right now in the medical system, we say, oh, it's dopamine, it's serotonin, blah, 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 all these things. The reason that we have a serotonin deficiency, Franz, serotonin is maximally released in stressful conditions. We learn how to manage our stress. We can learn to rebuild our serotonin, and then we can learn how to better effectively cope. So it's kind of like upside down, inside out, and completely backwards instead of forwards that we have to do.
right.
But that's what's going to work.
Yeah. So yeah, instead of having SSRI, learn how to tackle certain things. So in schools, instead of learning all this stuff we don't need, could we actually learn how to sit with uncomfortable feelings and how to think positive and how to deal with the mental issues when they arise? And that would be such a good thing. So it's a change in the medical profession, but it's also a change in the educational system where we're teaching people to just get the pill, get the pill. I don't want to, how do you say, turn off a fire alarm. I want to see where is the fire and I want to tackle that fire. Because if I just turn off a fire alarm with something that suppresses the symptoms, I'm really having the same problem. So I'm still in the same abusive family. I'm still with the same abusive husband or with the same drug addict son, whatever that is. That has not changed. So I have to change somewhere else. And so one of the big branches here is to explore these psychedelics. But as time goes, we don't have much time left. So we are forced to close here. So, well, guys, I hope that this has been very useful and maybe the beginning in a conversation for you at home who have questions. And feel free to look at all the links that I will be putting everywhere so that you can maybe have that call to find out what is there for you to tackle maybe a chronic condition that's been making you hurt for many years. So, thank you so much, Kathryn Walker, for being here in the show. It's been a pleasure.
Thanks, Franz.
So, everyone, make sure you share this with somebody that needs to hear the message. And I'll see you all next week. Bye bye.